Sanjeevan Life presents Batikram Mazdo, initiated Batikram Bishesh, Nutritional Week from 1st to 7th September, powered by Illumis Clinic. In this occasion, we have got Dr. Surabhi Kalita from Narayana Super Specialist Hospital.
Hello.
Welcome, Dr. Surabhi.
Thank you. Thank you for having me
It's
here.
our pleasure that you are here today. Now, Dr. Surabhi, can you tell something about yourself?
Okay. Professionally, I am working as a consultant anesthesiologist and a consultant interventional pain specialist in Narayana Super Speciality Hospital, Guwahati. So, I began my journey as a doctor by doing MBBS from Guwahati Medical College. Then I went to do my post-graduation in Guwahati Medical College in anesthesiology, followed by another post-graduation degree called DNB in Kolkata. It is by the name of VIMS, or Vivekananda Institute of Medical Sciences was the name of the institute. Following which I did a fellowship in cardiac anesthesia from Rabindranath Tagore International Institute of Cardiac Sciences in Kolkata. And thereafter I did a couple of fellowships in interventional pain management from IPSC New Delhi and from Kokilaben Ambani Hospital, Mumbai.
Okay.
So in short, that is my journey, and I have been working as a consultant in these two specialities in Narayana for the past 10 years now.
Okay, it's a long journey. Like generally you are dealing with anesthesia or in intervention pain?
See, both are different branches.
Yeah.
Anesthesiologist, as you all know, is a physician or is a specialist which takes care of everything when you go to a surgery, like right from your pre-operative preparation, whether you have any comorbidities, to optimize the comorbidities. Usually people have hypertension, diabetes, obesity, these things are very common, hypothyroidism and all. So surgery might have some adverse effects. So we optimize those conditions, we give anesthesia, make sure that you are unaware during the surgery, at the same time your hemodynamics is maintained, you are pain free during the surgery, and also during the post-operative part, whether it's a very smooth journey throughout the pre, intra and post-op. So anesthesia has got a lot of other branches also, say for instance intensive care or ICU care. That is an integral part of anesthesia. And a very new super speciality has come up in anesthesiology, which is like a super speciality. After you do anesthesia, you're qualified to become a pain specialist. That is about interventional pain, actually interventional pain medicine. So I have become much interested in interventional pain medicine because of my anesthesiology background, and now mainly I practice interventional pain medicine.
Exactly, can you tell me what is, how people are having this pain, or what sort of pain? Because I may have pain in my cervical or in my lumbar, but I don't know what pain it is exactly. Can you focus on that?
So actually, just to make you explain, because interventional pain medicine is a very new super speciality, and most of the people, even in the medical fraternity, are not much aware of it. It's like even now in a pain clinic is a very rare entity you will find in a big corporate hospital around the world, not only in India. So the concept of a pain clinic is, what we do is, we try to give a holistic and a comprehensive approach to the pain of a patient. Suppose you're having a back pain or any kind of musculoskeletal pain, or even like pains like fibromyalgia, which is a condition where you have a lot of pain in your body but you don't know whom to show, where to go. You don't know particular doctor. Should I go to an orthopedic surgeon? Should I go to a neurosurgeon, a neurologist, or a medicine specialist? Whom do I approach for my pain? So that becomes very dicey. So to navigate across all these specialties available, a pain physician is there, orthopedic surgeon, neurologist, psychologist, psychiatrist, a radiologist. So all these specialties we comprehend, we formulate a good holistic plan for the patient, so that the patient is guided well about the pain. or what sort of treatment, whether it is a surgical treatment, whether it is a non-surgical treatment that you will need to get rid of your pain. Now, when it comes particularly to interventional pain, previously, you know, the practice was such that if you're suffering from a chronic pain, suppose you're suffering from a long-term back pain or a neck pain, so first when you go to the doctor will give you a set of medicines, and that will continue for few months, and if you're not all right and you have some defect, some problem, like, you know, if you have a slip disc, or suppose you have a ligament tear, or any kind of an injury, musculoskeletal injury, or a tendinitis or something, they might advise you for a surgery even. So now that is a big gap for the patient, you know, from jumping to taking tablets to, you know, getting yourself operated, you know, letting your body cut. It's a very psychological trauma for the patient.
It's a trauma for all the patient, because we don't want to go for operation
directly,
you know, because we think that, okay, let's see if it's become,
if we can wait.
We can wait. We are waiting and at the end of the day we see the pain is still there.
The condition is getting worse by day. So actually painkillers are not a long-term solution. So these interventional pain procedures which comes under the specialty is like a bridge. It bridges the gap between the jump between the medicines and the surgery. So there are various techniques, you know, under this which we practice. Say for instance, technologies like injections under fluoroscopes or ultrasounds. You know, we take a potent anti-inflammatory drug and we inject it, you know, under direct vision. It is done in the procedure room in the operation theatre, and we will deposit a high concentration of that potent inflammatory drug right at the site where you are suffering from pain. So it's not an oral or an injectable IV. Secondly, there is a technology called radio frequency ablation, which is very popular nowadays. Here what we do is we take some, introduce some radio frequency waves through very small needle-like, you know, probes. And those will burn the baby's sensory nerves which are causing the pain right at your pain generator site.
Then you have to inject those
It's
needles?
like a very tiny injections. Those probes will introduce, and they will just, you know, stun those nerves which are causing the pain, and thereby will relieve you from pain. So you might need to repeat the procedure after 1 or 2 years, and most of the people may not even need a second therapy. Then thirdly, another one I want to tell you about is platelet rich plasma therapy. Here what we do is, it is this PRP or platelet rich plasma is very helpful for, you know, osteoarthritic knee, where people you see go for knee replacement surgeries. But if you come to us early, when you start having knee pain, knee problems, so what we'll do is we just take some amount of your blood. And in the laboratory, we will prepare a PRP or platelet rich plasma out of your blood. We'll take around, not more, maybe maximum 30 ml of your blood. From there, we'll just prepare a tiny amount of PRP, say 2 to 3 ml. That much is sufficient, and that part of the blood which is rich in platelets, it has got high regenerative and healing power. So we will inject it into the site of injury or site of damage. And after a few weeks, there will be regeneration of the tissue, and thereby there will be healing, and also the pain will be gone. So it is not any artificial thing, it is your own blood's healing power that I am using. So this is another one. Then we have got lots of things like stem cell therapy, you know, microsome therapy, and these are all coming up. Neuromodulation, there are a lot of things, you know, which research is still going on in pain medicine. These are coming up in a big way, and, you know, people really need to be aware about all these therapies, because they're suffering.
I myself, I'm listening for the first time. Then obviously our viewers will like it, because maximum we have seen nowadays, everybody is having pain, generally the back pain I'm telling about, knee pain, the elderly persons they are having this knee problem, they cannot, you know, walk for much longer,
climb up
stairs and all,
even climb down.
Even I'm talking about the, what do you call it,
cervical
neck pain. This is also very common nowadays.
Exactly.
So
it's all because of the, you know, addiction to the electronic mobile phones or laptops. But we are a part of it.
Means this all can be you know, cured with this therapy.
Exactly.
Okay. If it's a very long, like it's lasting for many years, like 20 years, 17 years, still you have hope in that. Okay.
Without surgery, we can try, and if at all it is in a state where it's, you know, like a motor paralysis of your limb, suppose it goes into paralysis, that state is where we, you know, really want to push you for surgery. But anything before that is very much manageable with these procedures.
Okay. Okay, Dr. Surabhi, tell me one more thing, that how is food, you know, our daily diet or our food habit is responsible for this pain?
Well, you know, it has got a, you might not feel, people might not feel that pain and inflammation is actually dependent, created by you and your lifestyle, but this is a fact. This is a fact, and I can tell you, as not only a doctor, but I have been a patient myself.
Okay.
So, you know, I got interested in fitness and nutrition because I have suffered and I have seen what is worse. So actually the thing is that the body's entire mechanism, metabolism, everything depends on what you eat and how much you use your body in exercising, because our body is not meant to, you know, stay in a inactive state. Our bodies, joints, muscles, everything needs movement. So movement can only relieve pain, and nutrition is a very major part of your fitness, of how much your body responds to pain and inflammation. Having said that, I want to just burst some myths when it comes to nutrition. You know, people think that fat is bad. People, you know, people are now, they are going into, you know, American diet, you know, like burgers, pizzas, French fries. You know, they don't know where to pull the lever. But in nutrition science, if you say there are 3 levers, one is, first lever is pulling the lever of how much calories you are taking in. Second lever is what you are eating, what calorie you are eating, the quality of your food. It really matters. And the third lever is when you are eating, what time you are eating. If you want to be healthy, if you want to stay out of all your aches and pains and lead an active life, you have to pull either these levers in different times, or you can pull 2 of the levers together at a time also. But if you want to be sick, you need not, you know, pull any of the levers. But the first lever, as I told you, is calories intake, how much you are taking in. So there has to be a restriction. Definitely there has to be restriction, because now the nutrition science says calorie in, calorie out. That means you eat less and you burn more, and you're going to be slim and trim. But that is maths. That is a law of thermogenesis, energy in, energy out. But we are biological beings. We have adaptations. Our body has set points. Suppose when people go wrong about nutrition is, suppose you're going for a crash diet. First week you are taking 2000 kilocalories and you are reducing your calories to 1500 calories. And your body, suppose, burns out 2000 kilocalories in one day. So you are taking in 1500, means you are in deficit of 500. So if you continue like this daily for 1 week or so, you will lose your weight, mostly your water weight, and you will see that this is good, this is working for me. But calorie deficit in the long run doesn't work at all. The reason being, your body has a set point to stay in a particular weight. Suppose your next week, what will happen is your body will not burn 2000, it will burn 1700. Third week your body might burn 1500. So you're not even in a deficit when you're taking a 1500 kilocalorie diet. That means your body is slowing down the metabolism to get adapted to keep you in a particular weight. So in the long run, a calorie deficit, it will only delay your metabolism, decrease your metabolism, and ultimately will keep you in a plateau. Okay. So short term goal, calorie deficit is okay. For long term goal, the other two levers are very important. That is what you are eating. Now what you are eating, the best thing you should do macro balancing is you should have very little carbohydrates, moderate amount of fats and moderate amount of protein. The culprit of any disease, you can just give a safe bet and name insulin. That is the culprit of any disease.
Okay.
Be it your aches and pains, joint pain, even rheumatoid arthritis, you can say any kind of autosomal diseases, any kind of, genetic disease like hypertension, obesity, all metabolic diseases, this insulin plays a very important role. Now we have to know how to and when to regulate this insulin. Carbohydrates, I'm saying, is not good because starchy food like, white bread, potatoes, sugar, these are the number one killers because it will spike your insulin immediately. So we need to stop that. Insulin rising means your cells become resistant to insulin and you tend to develop diabetes, hypertension and all array of metabolic diseases. So you need to cut down on your carbohydrates, and fats and protein you have to balance out because protein also to some extent cause insulin spike, but fats never. Okay. But only good fat. By good fat, I mean a fat which is ample of omega 3s like fatty fish. Omega, omega fish oil, omega 3 rich fish oil, cod liver oil. Then you have nuts, more like walnuts, pecan nuts, macadamia nuts, which are low in carbohydrates but rich in fats. Then a nature's wonder, which is a fruit, but actually it's not sweet, though it's a fruit, and high level of good fat is avocado. Okay, so even meat is and eggs. So these are some of the sources of good, even ghee, butter. These are good fat actually. So you should have these as your
little,
moderate amount.
Yeah.
That should be your main energy source, not rice, white rice, or starchy things like pasta, pizza, bread, white bread, potatoes, fries, and blah blah. So, and now protein also, definitely we all know what are the good sources of protein. So we have to consume lean meat, good amount of any kind of vegetarian proteins like we have paneer and legumes and seeds which have got good proteins. So we have to balance it out. So that is all about nutrition very precisely, if I can tell you.
Okay. Do you suggest any exercises for those people, those who are having this pain, like carrying this pain for a long time?
Okay. So, see, exercise science again is a huge topic, but if I have to cover it, very frankly, if I want to tell you the concept of exercising, first of all, you have to understand what is aerobic exercise and what is anaerobic exercise. And you have to try and keep your exercising to aerobic. The aerobic classes which you go and attend where you lead to huffing and puffing and breathlessness, that is actually not an aerobic exercise but it's an anaerobic exercise. Aerobic exercise is when you are working out without holding your breath, without having to exert on your respiration. The moment you start exerting, the fuel source is carbohydrates. But when you are doing an exercise without exertion, like you are taking a walk, then your fuel source is fat, and we want to burn fat, isn't it? We want to burn fat, so we are exercising. So you have to go start with aerobic exercises like long walks, maybe jogging and all, and slowly you have to go for anaerobic like HIIT, high intensity interval training. Now you have to understand that these HIIT has to be very short bursts. You can exert to your maximum limit for 30 seconds and then take a rest for 30 seconds and then go on like that for maximum 5 minutes. And that HIIT, the way I told you to do, should not be more than 2 to 3 days in a week. Rest of the time you need to be active on your foot, keep walking, jogging, whatever, move, but it has to be aerobic exercise. Anaerobic exercise is very important for growth hormone. Growth hormone spike, anaerobic exercise, that is HIIT, is very important, but that has to be very short and very limited. Otherwise, if you are running in the treadmill with breathlessness for 1 hour thinking you're going to lose weight, that is not. It will leave you craving for a lot of carbohydrates after that, because now you're using your months.
No, Surabhi, the thing is that exercise, though everybody nowadays we are opting for many exercises. We go for yogas, long walks,
strength
and
training and all,
gyms and all. Even we try to manage our proper diet. But if we can't, like working ladies are there, means those are working. What they will do in this pain, if they are having such pains, what they will do?
I don't believe that one cannot have time for workout, because I am a very busy professional. I'm a mother also, so I have to manage everything. But I have realized, because I was very obese at one point of time, that is the time when I realized that I have to do something about it, because one flight of stairs and I would become breathless. Not to talk about my cosmetic value will increase when I lose weight. That comes last actually. So what thing is, it's priority. And as I told you, you don't need to rush to the gym every day. You can do minor stretching exercises, like aerobics. You can take a walk. Rather, you of course, I'm not saying in an acute stage, but in a person whose paraspinal muscles are strong, by doing a deadlift, what you do? You work on your entire back up to your hamstrings. So you make your paraspinal muscles very strong. So when you make your muscles strong, so similarly for squats, it will rightly act on your quadriceps, your back, your glutes, everything. So if you make those compound muscles, and if you are regularly practicing it in the correct technique, then there is no way that your joints and ligaments will give way. Because your muscles are strong. That's what we do with physiotherapy. We give exercises to make our muscles, which are supporting our joints and ligaments, to make them strong. So you have to do strength training, especially for women. I'm saying weight training is very important, because that is the only way you can increase fat burning, because growth hormone spike is maximum in strength training. So it is very important. You have to combine cardio exercise, yoga is a stretching, strength training or weight training, but all under supervision in correct techniques. It has to be a mix and match.
Thank you, Surabhi. Thank you so much. Viewers, today we had lots of handful of valuable information regarding pain. I hope you have liked today's episode. Thank you very much. See you in the next episode. Till then, stay safe and healthy.